Nurses spend anywhere from 43% to 48% of their day on non-clinical work. So we have people that went to school to take care of people that are spending about half of their day not doing that. We've got a great partner that we're working with on some clinical documentation pilots. With these AI pilots, we're finding we can get that 65 to 70 minutes of charting time down to 15 minutes.
From healthcare IT leaders, you're listening to Leader with Ben Hilmes. Our guest today is Chris Mate, Chief Information Officer for Elara Caring. In our conversation, Chris discusses how aging populations are driving the rapid growth of home care services and how innovative new technologies like AI are increasingly necessary to respond to that growth.
Chris, great to have you on the program. I spend a lot of time talking to CIOs and other leaders, kind of in what I would call the core of healthcare, the delivery system. And so really exciting and going to be a lot of fun to hear what's going on in the fastest growing sector in our industry, and it's called home care. So it's amazing to see the growth in that space. Elara Caring, one of the largest providers in the country. I'm pretty familiar with the brand because I live in the Midwest. I know you do as well. But for those, our listeners who aren't as familiar with who you are, what you're doing, I'd love for you to just kind of get started by talking to us about who you are, kind of what you guys do, your approach, what's the strategy, et cetera. So I'll start there.
No, I look forward to it, Ben. I love telling the story. So Elara Caring deliver health services in the home, as you mentioned. So really think about that across 4 key product lines, if you will. Personal care services, which tends to be very Medicaid-based, non-clinical type work in the home. Traditional skilled nursing in the home, so wound care, infusion, post-acute surgeries, those things. We also have a hospice care for the end of life. And then a growing behavioral health business, which in the East, more centered in the East Coast in medicine administration, but growing along with service with our other service lines. So just to give you a sense of scale, we operate in 18 states. I tell people if you took a ruler from New York to Texas and drew a line, that's mostly where we're at. But on any given day, we're taking care of 60,000 patients, approximately, a little over 26,000 employees. And the number I like to use, because I still shake my head at sometimes, Ben, we do 1 million visits each month into homes across those 18 states. So the scale's remarkable.
That kind of leads me to, if you think about the major drivers, 1, it's the aging population, 2, people's desire to age in place. So the interesting thing is when I talk to my retirement planner, he describes your retirement as being kind of 3 phases. 1, the first one's go, the second one's slow go, and the last one's no go. So it'd be interesting to see how you guys are thinking across the spectrum of people aren't just in one place. So they might be their home, they might be traveling, it might be in other places. Do you guys do some unique things there to allow people to be mobile at the same time age in place?
Yeah, it's a great thing. I think nearly everyone agrees that being home is the best place to get healthy. And really our various products, it's about meeting people where they're at, right? So there's as people come in and out of the hospital, we're seeing patients with greater and greater acuity coming out and needing, different levels of care in the home as they really just strive to be home. And, you and I were talking before, I think as we, this world went through the pandemic, hospitals are amazing. But I think we also learned that, man, unless it's a service you can only get in a hospital, you're probably better off being in another location. We're really leaning into that. Whether it's those personal care services I mentioned, we have 18,000 personal care aides in 9 states delivering help to folks in the home that a lot of time is not clinical, but it helps them do just that. It helps that mom, that dad, that grandmother stay at home and heal there.
That's fantastic. So Chris, let's flip a little bit to the tech side of this thing, because, we're in an industry that's already really constrained with resources. And so now you're seeing this expansion and growth in the home care space. You can't just throw more and more people at it. So you've got a big job trying to figure out how do you leverage technology to drive value across Elara Care. And so help me understand how you're thinking about the leveraging of technology to deliver on the mission.
No, I love talking about this, right? And you're right, there's no cavalry of nurses on the
Right.
horizon that's about to, we know there's a nursing shortage. So when you look at industry statistics, and this is including nurses in hospitals, those stats tell us nurses spend anywhere from 42, 43% to 48% of their day on non-clinical work. So it's administration. In my world, getting people home to home, it's logistics and those things. So we have people that went to school to take care of people that are spending about half of their day not doing that. And I tell folks all the time, I've got a daughter in nursing school. She never calls me to go, Dad, I learned this neat trick in the EMR that at school this week, right?
Yeah.
I learned this cool way to chart. She's calling to tell me these very real stories about the gentleman she took care of that had dementia and thought that she was his daughter, right? Those are why those people get in the business. And Scott Powers, our CEO at Elara, has challenged us to go, we need to take this 50-50 split between clinical care and administration logistics and make it 80-20. We want to let caretakers spend 80% of their time. So that's a lot of my focus is how do I get friction out of the job and create nursing capacity by making this really the best nursing job in the world to do. So what are we bringing? I think it's one of those areas that AI really has some opportunities for us. We've got a great partner that we're working with in Oklahoma, Apricot AI, on some clinical documentation pilots where the start of care for a skilled home health patient, we typically spend an hour or more in the home doing assessments and over an hour charting afterwards with what CMS requires. With these AI pilots, we're finding we can get that 65 to 70 minutes of charting time down to 15 minutes.
Fantastic.
Yeah, it's really game changing for nurses who in home health have often spent their entire day on the road going house to house, right? And then they go home and while they're trying to be a mom, a wife, a husband, a father, those things, they're charting in between helping with homework. And so my real passion is I want to get these nurses so they can take care of patients. They can go home at the end of the day and leave the tablet in the car. For me, it's we're not going to hire our way out of labor shortages with nursing. We've got to create capacity by using technology to move the non-value added stuff to whether it's AI or other technology platforms.
So you bring up a good point. I mean, you think about your geography, the ruler from New York to Texas and hundreds and hundreds and hundreds of people in the field every day. As a CIO, that's got to create some headaches and some challenges and just the logistics. I know you guys are big users of ServiceNow and Aspire and use, really strong technology processes, procedures, et cetera. Talk to me about how you've had to bring the rigor to a different level to ensure that you are able to, one, deliver that patient experience, but at the same time, I mean, just as important as your provider experience. So you seem to have a lot of passion for that. So how are you doing all the things that you know and the tools at your disposal to achieve that?
I've got 9,000 mobile devices out in the field easily, let alone other devices, the folks use. So I'll use this term with you. And that technology has to be like dial tone. If you remember the day is when you pick it up, it's got to work and it's got to work right the first time. And it's got to put down because my folks are out in the field. There's no safety net. There's no going down to the nurse's station to get a different tablet, laptop, those things. It has to work. So it really is a lot of focus around process. You mentioned ServiceNow. We've done quite a bit to automate our IT support processes using the ServiceNow service management products. My nurse may have 15, 20 minutes on a drive in between two visits to make a call or pull to the side and do a chat session. She's got to be able to get her answers now, get her problem solved and moved on. We're also in the beginning of rolling out for our HR services, a ServiceNow product, same kind of thing. That nurse who needs to find out, has a question on benefits or payroll or a PTO policy, we've got to get that information to them very quickly, right? Because their day needs to, I got to get to that 80%, right? Where they're really focused on their patients. They're using these tools to just get the information they need in a way that they can consume it wherever they are.
That's fantastic. So a question I would have, if I think about one, you talked about AI a little earlier, but then I start thinking about some of the most important things around monitoring, censoring inside these patient homes. And then in the traditional setting, during COVID, we saw this massive migration to virtual remote care. Have you guys seen the same kind of pendulum back tick that we saw or are seeing in the traditional healthcare, or have you guys continue to lean into the virtual, the remote monitoring, those kinds of things?
No, it's a great question. I was in the hospital when we watched all the doctors' visits go to virtual and then come right back. We are definitely leaning into that where we can. In some cases, the reimbursement models don't yet support well enough those kind of tools. I will tell you, there's a number of places where, where we can get into kind of risk sharing type agreements with certain providers that we definitely have leaned into, the pulse ox, blood pressure, those kind of monitoring, those kind of things. But I also tell you, with doing as many visits as we have in the home, it's also collecting that data. If I'm putting a PCS aid into your home 3 times a week, I'm collecting data that we bring in, and we're constantly looking ways to refine on, hey, are we seeing any changes in condition? How early can we see those? Is there an opportunity to bring a different care intervention to let you, as we talked about at the beginning, stay at home?
Right.
So there's a number of places we're pulling in a lot of data. We tell people commonly we probably pull 100 million patient data points a year from all the visits that we're doing. And we're constantly looking at how we use those to identify when a change in care is needed.
Question on cyber, because I'm saying I think about all these distributed geos you're in, all of these devices that you have either in the home or on your providers. I imagine as a CIO, that's got to weigh heavy on you. It's probably a topic that's discussed at every one of your ELT meetings, your board meetings, et cetera. What additional layers of strategy do you have to put in place given your overall model around cyber?
You're doing them all, if you will, right? I think you're thinking about that defense in depth, right? What are those best practices around the device, the heartbeat of the device, the multi-factor authentications, all those things, the awareness and training are big things. As you look at most of these ransomware hacks have typically started with social engineering. So you can never educate too much. We're doing all those things. But you're right, a lot of sleepless nights. Healthcare has been quite the target the last couple of years. And, I've been asked a couple of times, what do you do to stay ahead? I don't know if you ever stay ahead. You just try to do everything you can as you've got bad actors that are exceptionally motivated. I think cyber is one of the first areas into AI. If you look at years ago with the things that, the abnormals and those folks of the world, and the things they do to help us deal with spam, we're seeing the bad actors use AI to improve their social engineering. So it's one of those, not to quote a movie too, you want me on that wall, you need me on that wall. It's forever diligent on there. And a lot of it still is the basic blocking and tackling of training and awareness, because that's where so many of these exploits start.
Yeah, that's right. The layer effect seems to be kind of a very natural strategy in the cyberspace. So I'm also thinking about, as somebody says they want to age in place, and you guys believe that the best place is at home. Unfortunately and inevitably, sometimes that's not at home, right? They will need to seek care from a hospital. So there's probably this migration out of the home, into the hospital, back to the home. And at that same time, those providers want to see all this data, all this information, and patients want to have their information present on, encountering with the health system. You guys work with a lot of health systems. How do you partner to share data and ensure that, as providers are changing hands or patients are changing hands with providers, they have what they need to provide the best care?
It's something that we've been challenged in healthcare, for forever, it seems. And there's probably still more promise around interoperability than traction at times. There's a number of things when I think of the front end of the process, getting referrals in, right? Interacting with, whether it's a payer, whether it's a health system on, can we take your patient? Do we have the right arrangements with payers? Do we have the right geography, right skill sets, those capacities? And we're continually looking at how we use the data. We've got a couple of active projects going on now. Is what's the best way to use that data in a way that impacts our ability to take care of those patients. So I think it's something that'll continue to grow as we all lean into that. We plug into some, HIE like networks and those things for knowing where our patients are and those things, but we'll continue to lean into that.
Do you see a day where it's seamless? Because one of the things we used a lot when my time at Cerner is a tagline. It's, healthcare is too important to stay the same. And secondly, ultimately it's personal. So Do you see a day where you can go across the continuum and not have to worry about this thing called interrupt?
I'm going to believe, Ben, that the day's out there. I'm not sure that I'll see it. Healthcare is such an interesting story in America, right? The way we pay for healthcare drives a lot of behaviors there. So I think that'll always be the case, but I think it's something we continue to strive for. I mean, I'm doing a couple things now with different partners based on a fire interoperability model that felt like something that was just really futuresque not too long ago. I think we'll continue to see growth in that. Will it ever get to where it's perfectly seamless? I don't know. Then at the same time, I should be careful because I watched Elon Musk land a rocket
Crazy.
and catch it with some chopsticks the other day. So I'm sure the know-how's out there. It's probably more about the will to do it. So
Yeah, no, I think that's right. I still believe the day's out there. I just think we got to, a little bit of choose to go to the moon mentality, fix the problem and lean in to do it. Let's pivot a little bit to every time we do one of these leader to leader podcasts, we talk about leadership. It's important. The industry needs more and more good leaders like yourself. And you spent a lot of your time at BJC and you were leading a big org there, running all the apps, BP applications there, thousands of apps, I'm assuming, if you had to count them all. How did that experience kind of prepare you for what you're doing now? And just love to hear how that transition went.
BJC, what a great brand here in Missouri. Just awesome hospitals, Children's Hospital, Barnes Jewish. I think you learn a lot of things in healthcare. Whether it's folks ask, it's not a 24/7 job. It's kind of 25/8, I call it. And I had a health experience where I was in for several days, and I remember in my brain thinking, when they were taking this blood test, boy, I hope the integration with Cerner's working, right? And you think that way. It's really, you personally identify with that. I learned quite a bit. Great team there. Jerry Fox, I work for at BJC, and a number of us have moved on to CIO roles that came from Jerry's team, but I still stay in touch with those folks and constantly learning. And BJC is one of those that has an academic medical center, has community hospitals, has home health, has hospice. So I got to see healthcare in a lot of different models. Got to see how those things need to work together. And I think that's really informed me as I move forward into the Elara Caring role. And you see that kind of longitudinal view come to fruition when you see we need all these parts of healthcare. We need the primary care physicians and those more, predictive and proactive care. We need the hospitals for, amazing events like childcare births and other not so, hip replacements and cancer and those things. Then we need home health. Right. When you look at, there's just not enough capacity in the hospitals at time, but also how do we help people get better the easiest? And getting better is often a team event for folks. That home, their family is all involved in that. And really, I learned a lot of those things at BJC that I think we had over 3,400 beds. You could see a little bit of everything there, and really proud of my time there.
You seem to have this demeanor that's kind of service oriented. You want to take care of your customers. You want to take care of your providers. You definitely want to help them take care of their patients. Where does that come from, Chris? It's hard to teach. And so when I come across people like you, you just seem to have that. It just seems natural to you. I'm just curious where that came from.
Well, I appreciate that. And you've got a great healthcare career, Ben. There's so many of us that get into healthcare and then you just can't get out, right? The mission is so self-evident in here, right? And it's hard to imagine. And I worked for a top 10 bank. I've worked in freight logistics and some neat things. But once you get in here, the mission's so self-evident. I think for me, it's also very personal. My mom's a retired hospice nurse. The number of hospice stories I've heard from her over the years, as I mentioned, I've got a daughter in nursing school who's going to commission as an officer in the Army and go work as a nurse in an Army hospital. Those kind of things really resonate. And people, when they find out where you work, everybody's always got a story. When I worked at BJC or I work at Elara Caring and I talk about we have hospice, and people tell you with a tear in their eye about what this hospice nurse did for their family at the end and those things. That makes this really personal. And for me, it's been really neat. And, a real big advocate of, in our world, getting my IT folks out on ride-alongs with nurses and into branches. And when they see the connectivity and the real impact that they have, and it's one thing to set up a tablet right in the back office before it leaves a depot. It's another thing to go out and see a nurse who's like quarterbacking care, social work, family dynamics in the home in a tough health situation, and see that when the tablet just works the way it's supposed to, she can focus over there, right? And so it's really neat. And I tell my folks a lot of time, Ben, when we're really good in healthcare technology, we're almost like referees at a football game, right? If you leave a football game talking about the referees, they probably didn't have a good night. But if my nurses and our caregivers can go in and out and not even think about the tablet very often, man, that's about one of the highest compliments we could have.
Well, that's a great story. I love just getting your folks to get that real firsthand experience connection. I used to do that at Cerner, as we'd have a lot of engineers. We'd have a lot of folks that never left the four walls. Let's go on a little visit. Let's take a walk. Let's go meet some docs. Let's meet some nurses. Well, this has been great. My she's a sophomore in high school, but she wants to be a nurse. So I'm excited to hear that your daughter's going down that path. I love the fact that she's leaning into the military. That's great. I noticed Elara Caring has a tremendous focus on veterans.
Yes, absolutely.
You guys do a lot of amazing things. As we wrap, we talked a little bit about interop as something we hope we both can help solve down the road. But in just this broader continuum, the space you're in around home care, what does it look like 3-5 years down the road? Are there a couple big things that kind of stand out that, hey, me, Chris, my org, we've got to go get solved?
I'm really interested we're at the very front end, but the impact that AI is going to have. And I kind of look at it in two buckets, Ben. One, really this kind of operational logistics things where we know the answers, but AI can help us get there very quickly, right? And so dealing with sometimes the healthcare intramurals between payers and providers and patients, I think there's real opportunities for that with AI to clean that up. I mentioned the pilot we have going on in clinical documentation. But I think there's that other bucket that will grow where AI really becomes a resource in clinical triage, developing care plans, those kind of things that'll be exciting to watch and be a part of. Because again, as we watch that growing aging population, if the nursing population isn't growing to meet that, we're just going to have to get better at doing this. And I think AI shows a lot of promise there, some nerves at times, but I think a lot of promise in helping us create capacity there.
I think those are two big things that need to help get solved. And AI can certainly help us solve a number of those things. I think people are just dipping their toe into the use cases right now, and it is probably the most promising thing I've ever seen in my career that truly has the capacity to fundamentally transform. So it's really exciting to see how people are using those tools and those capabilities to reimagine delivery. So it's really, really neat. You guys are in front end of that. Well, Chris, this has been great. Appreciate your time. I know you're a busy guy. Got to get you back on your day, but this has been fantastic. Thanks for joining the program, and I'd love to have you back at some point here to see kind of your continued progress and success.
All right. Well, I appreciate the opportunity, and absolutely. But let's definitely talk again in the future.
That sounds great. I hope you enjoyed my talk with Chris. There are several great takeaways from our conversation. Here are a few that stuck out to me. 1, our aging population wants more options for healthcare in the home. That is great news for home health providers like Elara. 2, Chris thinks AI can alleviate nursing shortages by making providers more efficient and reducing their administrative tasks. In short, he sees technology as a tool to create capacity. 3, Chris wants his team members to ride along with caregivers in the field. It's a great way for IT staff to connect to their mission and to better understand the needs of home care providers. So what did you think? What are your big takeaways from this episode? I'd love to hear from you on our social media channels, or drop me an email from our website at healthcareitleaders.com.
Thanks for joining us for Leader to Leader. To learn more about how to fuel your own personal leadership journey through the healthcare industry, visit healthcareitleaders.com. Don't forget to subscribe so you don't miss any insights, and we'll see you on the next episode.